Hi, my name is Melissa. I'm also known as the Modern Mortician, and I have invited my friend Emily here today to tell us what's going on in Washington in regards to COVID-19 or the coronavirus. Emily, tell us a little bit about your background and then break into what's going on.
Hi, yeah, thank you for having me on. I'm happy to talk about it, especially because it hits so close to home for me. I am currently a mortuary science student in Kirkland, Washington, where I'm finishing up my last quarter. Unfortunately, school has been closed down due to the coronavirus outbreak in our own school. 16 students went to the Life Care Center nursing home in Kirkland, which many may recognize as the epicenter of the deaths we're currently having. I am also a funeral director apprentice in Kirkland, Washington. Matter of fact, we have helped 4 families so far who lost loved ones due to the coronavirus.
Whoa, that is incredibly close to home. Here in Texas, we have had outbreaks now in Houston and San Antonio. 19 total infected people in Texas, while the maps are currently showing today on the 7th of March, 2020, that there are 91 in Washington and over 100,000 infected people worldwide. I believe I was doing some research earlier, and the first death happened on January the 18th in the United States, and it has snowballed since then. A big festival for the Austin, Texas area is South by Southwest, which was about a week away. They just canceled it yesterday due to fears of people traveling from all over the world being in one closed in space and possibly spreading this virus everywhere. I understand that you've helped some of the families. How are you making arrangements with these families that have loved ones that have died of COVID-19?
Well, first, we of course reach out and offer, offer our condolences. But we ask them to work remotely. So we're calling them on the phone. We're saying, hey, is there any way we can do most of this over the phone or over the internet? I know they have secure signing software, but unfortunately, most of these people are elderly that are passing away. And so their spouses are elderly, and it's kind of a learning curve to get all of our paperwork needed to cremate. We aren't even picking up many of the decedents from the medical examiner until they're ready to cremate, just because we aren't sure the virulence of the disease on corpse. Just in case, we're going straight from the KCME to the crematory.
Gotcha. What are some of the precautions that your removal staff is taking when handling one of these decedents?
As of right now, we're in full PPE. That means full gowns, full gloves, face mask, even face shields. This is an upper respiratory infection, so we know that it's probably not something that's going to be carried on their skin, especially after they've passed away and been autopsied, but it's better safe than sorry. And so we're having scheduled removal times at the KCME. They're going to be in full PPE also. And we're going to make sure that whenever they get to the crematory, there's not going to be any lag time between dropping them off and cremation.
What does it look like in Seattle and the surrounding areas right now?
It's very apocalyptic, or pre-apocalyptic rather. The traffic's light, which is really saying something from Seattle. All the grocery stores, Costco, have been hit up for all their paper towels, all their hand sanitizers, face mask, and everything. People are kind of going into panic mode, and rather than listening to the CDC, they're prepping, like doomsday prepping.
Yeah, as if they were all going into containment on their own, right?
Right, and it's mainly because we don't know much about this. We can assume a lot of things because it is a SARS virus. It is something that can be spread through droplets. That's what we know from previous contagion. But we don't even know the latency period. They're estimating from 2 to 14 days. So a lot of people can be infected and not show symptoms.
Understood. I was reading an article on Funeral Service Insider earlier that was contributed to by Monica Torres, known as Cold Hands. And she was suggesting that professional grade wipes be used in sanitizing areas, full face respirators, having proper ventilation in the prep room. I know in Washington State you have a high crematory turnover, correct?
Correct. About 85%, and it rises every year. So a lot of the times we're not even going to be dealing with unembalmed or embalmed viewing in this case.
So for other states that do have a high turnover or a high production of the open casket funerals and things like that, what are some additional precautions you might take with the decedent if they were going to have an open casket viewing?
Yeah, as Monica Torres said, full face respirator is very safe. That's what we use in extremely contagious cases, like Ebola. I know that for Ebola cases, that was a huge worry. We're not necessarily looking at that much of a violence, but embalmers should always use universal precautions. Funeral directors should always use universal precautions. We should always have gloves, maybe even a face mask. But up here, we're not, even if we had a viewing, it's not the decedent we're worried about. We know that viruses don't live long on corpse. They need a host to survive, but it's a family. They could be carriers. They could be giving it to everyone else. So that makes viewings a little bit of a dangerous situation. We should always be sanitizing.
Correct. Well, have you had any close calls with family members coming in?
The first case we had, it was a very close call. It was about a week ago now. That's whenever Life Care Center started to really figure out that they had an outbreak. We had scheduled her to come in the same day. She called and she goes, you know what? I think he passed away from COVID-19. I don't want to come in the funeral home. I'm going to get him autopsied and I'm going to get tested myself. And we are so thankful that she did, because she ended up having COVID-19.
See,
And
one thing that I wanted to bring up was the glove usage. Something that a lot of funeral homes may or may not be aware of is that these gloves that you get at like Walgreens or Costco, they're permeable. Like that is a huge thing between our professional grade gloves and the kind that you just get off the shelf at the grocery store. Have you noticed anything like that in your funeral home? Like you've got some off-brand gloves or anything of that nature?
Well, the facilities we use for cremation and handling our bodies is extremely professional, and they only use medical grade. I know funeral homes typically only carry medical grade, but what I'm seeing in public is non-medical personnel. They are buying those little face masks and those thin gloves, and that will do absolutely nothing. Carrying around hand sanitizer with you is not going to stop a virus. And so it kind of creates this panic rather than being educated on the actual spread and cause of a virus.
Understood. Well, did you have anything else you wanted to add to this before we, end take 5?
Yeah, if there are any pathologists or microbiologists that can give more of an insight into COVID-19, I know that we know quite a bit about SARS in the previous outbreaks, but this one is completely new. I think funeral professionals should really be looking into virulence on a corpse. We should learn about the latency period and the exact symptoms, because right now it's just fever and cough. That could be a number of things. Unfortunately, it's hard to get tested right now. It's hard to take off work, especially as funeral directors. We don't get that luxury.
Right.
Just be careful and vigilant. That's all I have to say.
Excellent. Well, where can people find you online if they want to answer those questions for you or reach out about anything that you've experienced?
As of right now, I'm just on Instagram as Adiposer, and that's a pun on mortuary science stuff, but it's ADIP0SER. I'm more than happy to chit chat with people, students, anyone, just to get more information.
Excellent. I'll add your links underneath the video. And thank you so much for joining me multiple times today, Emily, to get this informational video out to our colleagues and other students and the public.
Yeah, thank you.
All right.
We'll
You
talk
have a
soon.
great day. All right.